Eric, each one of these represents 5 pounds of fat.
And how well I know Andrea, I've lost over 10 of these in the past year.
We know that a lot of you viewers out there are trying to do the same thing.
And in this week's special edition of Health Talk, I'm going to talk about my personal experience with weight loss, and we're joined by an expert in weight loss and healthy living.
Stay tuned for a great show. We'll be up next. Eric, as we mentioned in the tease, you've lost a lot of weight.
Yeah.
You've been very successful. What helped you move from thinking about it to actually achieving it?
Well, I think that what I want to emphasize is that it took me 25 years from the time I started to gain weight to the point where I really was able to make that decision. And it really is a decision. Unfortunately for me, it took what turned out to be a minor medical event. But it was, as a doctor, I worry about the worst things, and it got my attention. And I was over 60 years old. I had been thin when I was young and gained weight steadily from about late 30s on up, and tried every day of that 25 years to lose weight and couldn't. And it really took that, and I made sort of a bargain. I said, if this turns out to be nothing, I am not going to take any more risks with my health, and I'm going to do what's right. And what you've been saying is what's right. And there's no magic out there, is there?
There is not. It's hard work.
And
it's every day.
We want to show our viewers exactly how successful you've been. So in a moment, we'll bring up some actual photos of.
Yeah, these photos are a year old that my wife and I took on and I actually thought I looked okay in these photos. I looked back at them. I was fat. And I clearly made the obese on the tables. There's another picture of, it was a lovely trip, but was not a lovely person. And point out, I'm moderately athletic. I hike, I ski, I do stuff, but I was still fat, and I didn't like the way I looked. And you make up lots of excuses for it. And I actually don't think you really see yourself as you are, because you don't want to believe that you're that much overweight. People say, oh, that obesity level in those tables set way too low.
That's right.
Let me talk as a fat person, because in my mind I will always be a fat person. The fat person, and we've talked about this before the show, you wake up every morning, and that's the day you're going to start your diet. So I think every fat person wakes up every morning and says, today, unless it's their birthday or they're going on a holiday, today I'm going to diet. And you diet for 4 hours or 6 hours or 8 hours, and then your willpower breaks down and you have a cookie or a piece of cake, and you say, okay, I'm not dieting today anymore, I've lost it, but I'm going to diet tomorrow, so I want to stuff myself today. So this is my last chance in life to feel good about food. And that happens day after day after day. And maybe you go 2 or 3 days, but then you break it and you're back on that same cycle. Dieting is not the answer. And I just can't say that strongly enough. If you are going on a diet, you are destined to fail.
Tell people what you mean by diet.
Yes.
If you plan to have a short-term period where you lose weight, and then you're going to go back to normal eating, which is how you gain the weight, you will not succeed. It really requires a decision to live differently. And that is really hard to accept, because I think people think, oh, that I'm not going to be able to enjoy food anymore, right?
Well, that's
because that's what for me, it was, oh my God, I'm never going to enjoy a steak dinner anymore. I'm never going to enjoy chocolate. I'm not going to be able to eat cake, which is also all wrong. Let me say this to our viewers, you guys out there and me. The difference between being fat and being thin is a couple hundred calories one way or the other a day. It really is that much difference. So you don't have to eat that much less to be thin, and you don't have to eat that much more to be fat.
That's exactly right. About 300 calories a day equals about a pound a week.
And that was my goal as I went into this. And I did not count calories, I didn't measure meat, but I just knew what lean foods, and again, we're going to talk a lot about this in the second segment, but looking at what I ate for breakfast, I can go through it. A piece and a half of toast. Rather than a big glass of orange juice, a small glass of orange juice. Right. I used the no-calorie butter rather than any calorie butter. Right. At lunch, I had an egg and a low-calorie yogurt, and no starches at dinner. I went from a beer before dinner to a light beer before dinner.
Right.
And that was enough. And exercise. And I do want to say, and that's the hardest part, I think, is that uses up calories. Yes. And even though it doesn't use up 3 pounds of calories, it uses up 100, 200, 300 calories a day.
Right.
And that's enough to shift that balance from gaining weight to losing weight.
That's right. Well, if all of a
I'm
sudden...
telling you what to do. You've always been thin.
But I love that you're saying that and sharing it, because it is what we say. But a lot of people haven't made that decision yet. So much what you talked about.
And let me just, we're running out of time, but I just want to say one other thing, is that I think people like me who have been fat or are fat look at the thin people around us and say, oh, well, their metabolism's different. Now I'm going to speak as an old man who's talked to a lot of people as a doctor and as a friend. Most thin people work at it. It doesn't, you're gorgeous, you're thin, but you think about what you eat every day too. And so do most people I know.
Do. Everybody I know thinks about.
So fat folks out there, again, they're not naturally thin, they've just made the right choices.
How healthy is a vegetarian diet?
That's a great question. Luckily, we have an expert on the set to help us answer. Cindy, how healthy is a vegetarian diet?
A vegetarian diet is very healthy.
There are a few that, though, are typical that I think we should point out. B12 is often in meats and is not particularly well represented in vegetables, so you may want to supplement B12.
That's right.
And then iron is an issue. Iron, this is one of my favorites since I'm a hematologist or blood doctor. Iron is best absorbed in the form of, it's called heme iron, in other words, blood iron, and you get that in meat. Red meat. So without that, you have to be a little bit careful about your iron.
Yes, and
So with that, I think that's all. Those are all good tips. So vegetarian diet is healthy, and I think Andrea is having a frog in her throat. So if you have a question you'd like to ask us on Health Talk, please contact us at healthtalk@norwalkhealth.org.
Our great thanks to Cindy Sherlock for joining us on Health Talk today, and thank you to Eric for sharing your story with us all.
I just hope folks at home are able to, who are struggling with this, have the same success, because it's hard, but it really isn't. So I'm Dr. Eric Mazur. We'll see you next week on Health Talk.
I'm Dr. Andrea Peterson. Take care.
Eat well. Bye-bye.
Generators are valued commodities during power outages. Not that we ever have any here in Southern Connecticut.
But if you don't use generators correctly, you can generate more harm than good.
So on this week's Health Talk, we'll provide tips on how to avoid exposure to an invisible, dangerous, and sometimes deadly poison.
Stay tuned.
We're coming up next.
And it's a great thing to give you power when you have no power because of a storm, but there are some risky things that we need to take into consideration.
You know, I think after this series of storms, I know I've lost my power 3 times in 14 months, and I think many of us are now convinced that it's time to have home power. So I think, we're talking about not only to people who have generators now, but there are a lot of us in line now who are going to be installing them over the next many months. So yes, why are they so dangerous? The red cells exist, the hemoglobin molecule exists to grab oxygen from the air and to deliver to the tissues so that they can metabolize normally. And as you just said, carbon monoxide sort of gloms on to that spot which the oxygen should be, and it sticks so tightly it's not released to the tissues. So you basically suffocate the tissues by not delivering them oxygen. And the hemoglobin takes up carbon monoxide much more avidly, as you said, 250 times more avidly than it does oxygen. So you basically crowd out the oxygen. And one of the bizarre things is unlike someone who's not getting enough oxygen turns blue, that's not what happens in carbon monoxide.
No, actually, you can look quite normal, or maybe you look like you've had a few too many beers.
Here's this week's health question.
Hi, my name is Barbara, and I would like to know what causes nosebleeds.
Well, nosebleeds are very, very common, and they can be very, very scary because a lot of blood comes out. It's actually fairly simple. There are blood vessels very near the surface of the skin inside your nose. There's actually a complex of vessels there called Kisselbach's plexus right beneath the mucosa, right beneath the mucous membrane. And they're very fragile, and they can rupture. And when they rupture, they bleed very vigorously. So anything that leads to irritation or dryness or any damage to that area, that mucosa that overlies those vessels, leads to a nosebleed.
Exactly.
And just 2 seconds about treatment. Most of these nosebleeds are from the front of the nose. To stop the bleeding, pinch your nose. That puts pressure on the vessels and shuts them down. And you pinch it long enough for the blood to clot on its own. If you do this and you're continuing to bleed back in your throat, that may be a more serious problem.
That may be something to come to the emergency room, go see a doctor or an ENT physician, because sometimes you need to have a little packing in the back to get that to stop.
So very important advice. Parents look forward to the birth of their new children with tremendous excitement and anticipation.
However, things don't always go as planned.
But thankfully, new technological advances and highly trained hospital staff have greatly changed the prognosis for premature and sick infants. I think it's amazing. There really is a pacemaker in the heart. We call it the sinus node. And it taps out the beat of the heart. But that electricity then goes from that point down different, almost wires, pathways in the heart.
But Eric, that's a really important point, Peter.
And that's why people talk about stroke with atrial fibrillation, because you get this clot in an atrium that should be going like this, which is really, as you said, fibrillating. I've heard it described as a bag of worms.
Yeah.
Although I don't really collect worms, but because the blood isn't moving, and this is where the hematologist in me comes out, keeping blood moving is part of the way we keep it fluid.
Exactly.
You take normal blood and you stick it in a pool, it doesn't stay fluid.
Norwalk Hospital is the first hospital in New England and only the 6th hospital in the United States to be nationally recognized for its leadership in the fight against lung cancer. So Steve, tell us a little bit about the magnitude of the problem with lung cancer. It's one that I know strikes fear in my heart and everybody else's heart.
Well, I think what most people don't realize, it's a leading cause of death from cancer in the United States. A very big factor is asbestos. If you've had exposure to asbestos, a lot of men through many years past working on brake linings for cars or insulation.
Asbestos and mesothelioma because of all the lawyers who were advertising for that on TV. But lung cancer is really much more common than mesothelioma as an outcome of asbestos exposure.
Far more, and if you were exposed to asbestos, you have about a 4 to 5 time increased risk of lung cancer. If you smoked and had exposure, the risk is about 20 times greater.
Unfortunately, it used to be that with lung cancer, as you said, most patients were diagnosed late, and as a result, most patients who were diagnosed with lung cancer died of lung cancer.
Right.
And there have really been some breakthroughs in both the diagnosis and the treatment of lung cancer in the past decade. So maybe you could say a few words about those.
I think it's extraordinary. Lung cancer has evolved on so many different fronts. Patients who have a specific genetic mutation in their lung cancer respond dramatically well to these new cancer therapies.
Yeah, we get the point. This is very different than your father's chemotherapy.
Very different.
The chemotherapy that I used to administer largely targeted any cells that were dividing. So it poisoned the DNA, it poisoned the protein synthesis pathway, and you tried to titrate the dose so it killed more cancer cells than normal cells, but they had a lot of side effects, and they were dangerous to use because they damaged the blood and the linings of the mouth and the stomach. What we're really talking about here are being able to profile cancers so that we know the signals within the cell that are causing that cell to grow and giving drugs that specifically block those signals in certain instances. So they have much less toxicity, and although we call it chemotherapy, it really is genetically targeted therapy.
Yeah.
Other than being wonderful pets, these dogs have something else in common. They're part of the medical team.
That's right. When you're in the hospital, a visit from a pet therapy dog can boost your spirits and may actually help you heal faster.
On this week's Health Talk, you'll meet some of these very special pets and their wonderful, caring owners. We're coming up next. And we have less than 45 seconds left, but I'd be remiss if I didn't ask this question. I'm sure there are people at home watching this who would like to do this with their animals. Somebody who's interested, how do they get started? What should they do?
Well, I use the Good Dog Foundation.
And I think a whole host of factors have brought us to this point. I remember back in medical school when Valium was the new drug. Remember the Rolling Stones' Mother's Little Helper. And we were taught, I remember specifically the lecture being taught that the only way to kill yourself with Valium was to smother under a pile of it. We thought thought it was a benign drug, and it's only over time that we've learned that it is addictive, really addictive. You become dependent on it. That withdrawal has effects, seizures, insomnia, anxiety, etc., and that you become tolerant to it, so you need to keep escalating the dose to get the same effect. So what we thought was a benign drug to help people over their anxious episodes turns out to have a long-term abuse potential. Earlier on in my career, we really avoided narcotic therapy for all but malignancies, except for Tylenol and codeine. But in terms of potent analgesics like Percocet or oxycodone, we really avoided them because of the fear of addiction. And then,
but now it's just the opposite. Now they're prescribed fairly routinely.
Exactly. I was going to say that there were some articles that came out that said that there are people with benign but severe chronic pain who could benefit from narcotics and lead a useful life on chronic narcotic therapy. And I think that unfortunately swung the pendulum all the way in the other direction.
Right. And they're fine all of a sudden, and then boom, they're laying on the floor.
And the classic is putting together benzodiazepine like Valium and alcohol. That says very unpredictable effects on some people. In fact, I just read an article on one of the CNN online about some young lady at college, I think, who'd had too much to drink. I think she took 1 or 2 Valium and died.
Yeah.
It's tragic.
This week's viewer question is, how do you prevent the flu and how does it spread?
Well, I think the first answer to that's a pretty easy one, so we'll give it to Bob. How do you prevent the flu each year?
I urge everybody, it's that time of the year, please get your flu shot. Get your flu shot.
The traditional flu shot is a dead vaccine. The inhaled one is live, and that's for selected group.
Right.
The traditional flu shot that you get in the arm is a dead vaccine. You may have a little immunologic reaction to it. You may get soreness, maybe a little low-grade fever.
But you
don't get the flu. Thousands
of
people die every year as a result of the flu.
And we have to emphasize that. They die every year because of it.
Because flu can lead to influenza pneumonia, or bacterial pneumonia, respiratory failure, multi-organ failure. We see it every year, particularly in the older, but pregnant women.
And the very young.
And the very young.